Hi, my name is Anika. I'm a student at the University of Northeastern Philippines. Today, I'll be demonstrating to you therapeutic positioning of clients. So before starting, of course, we have to make sure we have already provided privacy to the client by closing down the doors and drawing down the curtains so that we can provide comfort and promote privacy to the client at the same time. Now, of course, we have to prepare our equipment. So we will be using pillows, trocanters, blankets, and some other stuff that could promote comfort, like hand roll, such as that, or footboard. So since I'm in a home setting, I'm just going to be using the regular pillows that is available. So I have my client right here lying on the bed. Prior to approaching the client, I'll be doing proper hand hygiene using soap or water. Soap and water, as well as we can also use alcohol or antiseptic solution. So at this point, since my hands are not visibly, visibly soiled, I will be going ahead and use an alcohol or antiseptic solution. So now I have done my hand washing. I'm going to go ahead and proceed with confirming the client's identity and introducing myself. Hi ma'am, my name is Anika. I'm your student nurse for today. May I know your first and last name?
Nicole Estrellas.
Hi ma'am Nicole. So today I will be I will be helping you to position yourself on the bed. Of course, because you don't want to stay very long on the same position. So we can also avoid pressure source or some injuries because of lying too long on the bed on the same position. All right. Okay, so you can help me out by cooperating with me. I'm just going to go ahead and give you some instructions on how it will make it easier for us to transfer you to a different position, okay? Okay, great. So since I've already informed the client the procedure that I will be doing and how she can help, I'm going to go ahead and proceed with first putting the client into supine position. She is already in a supine position technically, but I'm going to do the supine position with support. So I will be doing this by installing or providing her with pillows behind her head, just below the knee, as well as on her trunks or below her trunks. So ma'am, I will be giving you some pillows to promote comfort, alright? Okay. So first, the first pillow would be for your trunks. I'm gonna go ahead and raise your knees right here, start to flex it. Can you flex your Alright, okay, you can go ahead and lay down. Alright. Now next pillow will be for her feet. I'm gonna be placing this just under her legs or her thighs. Alright. You need me to put the blanket on? Okay. Just give me 1 second. What happened to the blanket? It was folded. Alright, is that comfortable for you? Alright. Okay, thank you so much. I'm gonna go ahead, but I'll be back in 2 hours so that I can change you to a different position, okay? So next will be the dorsal recumbent position. We'll be doing this by slightly flexing the knees of the client while still on the same supine position. So ma'am, I'll be transferring to different position. I just need you to slightly flex your knees. On your left, right on your right. Okay. Now I'm gonna go ahead and promote comfort as well by inserting 2 more pillows on the client's hand. This is just for support and comfort. So ma'am, I'll be putting this here. Can you put your hands above it? Okay. Okay. So this position is the dorsal recumbent position. So ma'am, I'll be going back in 2 hours to transfer you. Do you need me to put back the blanket on? I'll be back. So next, we will be transferring the client into the Fowler's position. Now, there are three types of the Fowler's position. We have the standard, the low Fowler's, and the high Fowler's. First, we will be doing the low Fowler's position. Now, this position is approximately 30 degrees angle, elevating the client from the head to the trunk. So since I'm not in a hospital setting, I'll be using pillows to elevate the client's head. So first we will be demonstrating the low Fowler's or the semi-Fowler's position, which is approximately 15 to 40 degrees in angle. We'll be using one pillow. Now I will be needing to adjust your bed. I need you to just slightly raise your body, please. Okay. Just one. Here. Okay, go ahead and lay down. Now you can also promote comfort by putting another pillow under the client's feet. Now ma'am, I'll be needing to put this under your feet to promote comfort. Okay. Is that position comfortable for you? Okay, perfect. So then we will be demonstrating to you the standard Fowler's position, which is approximately 45 degrees to 60 degrees in angle. So ma'am, I'll be transferring to a higher position, okay? Just can we slightly pull up your body? I'll just be adjusting your bed. Okay, 1 second. Can you move up? Alright, okay, go ahead and lay down. Alright, now this is a higher degree in angle for the Fowler's or the standard Fowler's position. Next, we will be proceeding to the high Fowler's position, which is 60 to 90 degrees in angle. So for this, I'll be adding another pillow to muchly elevate the client. Okay, ma'am, I'll be adjusting you to a higher position, okay? Okay, just kind of pull up your body for a little. I'll be quick. One more pillow behind you. Okay, go ahead. I think one more. 1 second. Sorry about that. One more. Okay, you can go ahead and adjust yourself up. You can adjust yourself up. Like you're sitting already. Okay. Alright. Now, since this is a much higher degree in angle, it's called the high Fowler's position. Now, we can promote comfort to the client as well by putting another pillow under her trunk. And also trochanter's to support her legs. So we can put trochanter's here. And then another on the other side. Okay. Okay, so the high Fowler, semi-Fowler, and the standard Fowler's position is already done. I'm going to go ahead and go back after 2 hours, transfer the client to a different position. Now, ma'am, do you need me to put this back? Okay, 1 second. Okay. Alright, do you need anything from me? Alright, I'll be back in 2 hours to transfer you again, okay? So next, I will be transferring the client into lateral position. This is a side-lying position which promotes good alignment on the back. So I'll be needing to use a couple of pillows for this so that we can support the client and make it easier for her to stay in the same position. Hi ma'am, I'll be transferring you to another position now, okay? So this is called the lateral position wherein you will be lying on your side or sideways. So I need you to put your arms right here before I move you. Put your other hands across your chest. Slightly flex your knees. And this one. Now I'll be turning you to the side, okay? Alright. In 3, 2, 1. Alright. Now after turning the client to this side, we can put a pillow under the client's or behind the client's back to help her stay in the same position. Also, another pillow in the front of the client's chest. This is to support her upper arm. And then, making sure that the knees are slightly flexed, or the upper knees is slightly flexed. and put another pillow under the client's feet. This is to provide comfort for the client. Now we can use trochanter's to support or to protect the client's feet, putting it just at the back of the soles. So this is the side lying or the lateral position. Now, ma'am, do you need me to put back the blanket on? The next position is the Sims position. This is also a side lying, but it is slightly in prone position. So technically, it is in between lateral and prone position. So we will be doing this. Hi, ma'am. I'll be transferring to another position. Alright? Okay. So we'll be doing the same procedure as for the lateral position, except this time the hands or the arms that is lying beneath or under the client should be put just under the buttocks before we turn her to the side. So, ma'am, I will be putting your arms in here so that it will be safe once I turn you. Okay. Now put your other arms here across your chest. Slightly flex your knees. And then in the count of 3, I'll be turning you, okay? Alright, in 3, 2, 1. Okay. Now, we will be assisting the client to assume the position, putting her arms slightly flexed on the side, with her head slightly flexed or slightly turned to the side. Now, we will be supporting her by putting trochanter rolls on the side of her legs, and one pillow or a small pillow just in the front of her arms so that we can support and elevate her arms. And after that, we can go ahead and put another pillow under her feet. So, ma'am, I'll be putting this under your feet. Do you need me to put back the blanket on? Okay, we can slightly fix the client. So this is the Sims position. I'll be putting back the blanket on now. Alright, do you still need anything from me? Okay. I'll be back in 2 hours, okay? So next position will be the prone position or the abdomen lying position. This position is helps to prevent knees and trunk contradictions, and it also could be used to examine the back of the client and the head of the back head of the client, as well as the lower extremities on the back. So I'll be doing the procedure with the client with the help of supporting pillows. Hi, ma'am, I'll be transferring to different position, okay? Alright. So same procedure with putting the client in lateral or Sims position. I'll be asking the client to slightly flex her arms under her, or extend her arms under her buttocks, and then putting her other arm on her chest or across her chest. Now we will be asking the client to slightly flex her knees to help us with the movement. Now in 3, 2, 1, I'll be turning you to the side. Then I will be helping you to adjust yourself so that you will be facing down. Okay? Alright, in 3, 2, 1. Okay. Put your arms on the back. Okay, and your side. Now at this point we have to have the client's head turned to the side to allow the client to be able to breathe properly, even though she's lying on her abdomen. Okay? Ma'am, I will be needing you to turn to the side, please. Alright, now we have to fix the client's extremities. We will be putting support to the client's trunks. Abdomen. They're putting a pillow. Probably not if you are not going to, if the client is comfortable, or if the client is not, a hypotensive client, which is at risk for suffocation. We don't need to put supports. We have to just fix the client's position. Okay. Make sure that the client's head is turned to the side. Now we can put a small pillow under the client's feet. And one pillow under the client's waist. And I'll be needing you to pull yourself up so I can insert this pillow. Okay, and push down. Right. Do you need me to put the blanket on? Okay. So this is the prone position or the abdomen lying position. I'll be removing this so I can put your blankets on. Of course, put back the blanket to provide clients privacy before leaving the room. Yeah, I'll be back in 2 hours, okay? The next position will be the orthopneic position. This position is to provide maximum lung expansion and promote maximum respiration. So technically, this is being promoted for those clients who are having difficulty of breathing, those clients who have problems in respiration. So we'll be doing this by asking the client to sit down and lie over the table. Ma'am, I'll be transferring to a different position, alright? Okay, so I need you to sit down. Let me help you. Assist the client in sitting down. Slightly flex your knees, ma'am. Okay, pull yourself together. Alright. Okay, go ahead and go here. Alright. So I need you to put your arms here and the other. And then go ahead and lie down. Alright. Okay, so we can go ahead and put small pillows under the client's arms to promote comfort. So ma'am, I'll be putting this pillow under your arm so that you can easily lay down on a smooth surface. Alright. So my client is now on orthopneic position. So ma'am, I'll be going back in 2 hours, okay, to transfer to a different position. Okay? So next is the lithotomy position. This position is used usually on giving birth and genital examination. This position is wherein the client lies flat on the back with her legs flexed 90 degrees to her hips. So we'll be using, if we are in a hospital setting, we'll be using a specialized bed which have stirrups, wherein the legs were placed in the stirrups to maintain position. But this time, I'm going to go ahead and be resourceful. I'm going to be using this to act as the stirrups. So ma'am, I'll be transferring to a different position now, okay? Alright. Now, I will be needing you to place your legs over here. 1 second. And your other leg, please. Okay. Let me just pull you up. Okay. Alright. Okay. Support that. Let me just put it right here. Now, to emphasize 90 degrees, I'm going to go ahead and put pillows under the legs of the client. This is to help her maintain this position. But they also remember that this position should have been with a bed with the stirrups. I'm just doing this for the sake of the return demonstration. So this is the lithotomy position. Originally, the leg should be spread wider, this is usually used for childbirth. And also for genital examination. So, the lithotomy position. So next is the knee chest position. This position is to promote comfort to the clients who have difficulty in breathing. This is similar to orthopneic, but instead of laying on an overbed table or a bed table, we will be having the client to place her knees approximately closest to the chest. So, and now I'll be transferring it to a different position, okay? Alright. So first, I'll be placing her to knee chest position in lateral position. So now I'll be needing you to put your arms here and your arms here. Can you flex your knees first? Thank you. The other. Okay, I'm gonna pull you in 3, 2, 1. Alright. Now I need you to flex your knees as far as possible. Okay, closest to your knee, to your chest. Okay. Alright. Now do you need me to place a pillow under your arms? Okay. You just place a pillow over here. Alright. Can you slightly bend your head here? Okay. Alright. So here is the knee chest position wherein the client's knee is closest to the chest of the client. Now I should be doing this also to the other side, but I will be not be able to do that because I don't have any space on the other side. But we can also do this as the client is sitting. So I'm gonna go ahead and do that. So ma'am, I'll be transferring to different position this time, okay? Right, it's almost the same position, but this time you will be sitting, okay? Alright, so kindly go back to your old position. Slightly bend your knees. I'm gonna help you up, okay? Alright, then 3, 2, 1, go. Okay, bend your knees, and then put your arms here, and the other. Okay, you can lay down your head, turn to the side. So this is another version of the knee chest position. So this is another type of the knee chest position wherein the client will be laying on her chest and her knees are flexed to expose the rectal parts. This could be used for examination of the rectal area of the client. So we will be positioning the client to lateral position first. Now, ma'am, I will be transferred to different position, okay? I'll be putting the client's arm below her buttocks again and the other one on her arms. Now, I'll be turning you in 3, 2, 1, okay? Can you slightly flex your knees? Okay, 3, 2, 1. Now do a full log roll for the client. Put her arms on the side and the other one. Let me help you. Okay. Now can you pull yourself up? Okay. Alright. Now your knees should be flexing. I'll be flexing your knees towards your chest. And the other. Okay, ma'am, can you pull yourself up? Alright, great job. Okay, so this is the knee chest position wherein the client will be laying on her chest. Let me just help you up. Okay, make sure that the client's head is on the side. You can also put small pillows under the client's head to provide support and comfort, and also her hands. Also, we can put trochanter's just on the sides of her legs and the soles of her feet. So this is another option for knee chest position. Next, we have the Trendelenburg's position. This position is usually used for those clients who are having internal hemorrhage, specifically if the hemorrhage is on the lower parts of her body. Now, we will be placing the client, this time we will be placing the client in supine position, but this time we will be raising the lower part of her body higher than the head. So since I'm not in a hospital setting, I'm going to be using pillows to put the client into the Trendelenburg's position. Hi ma'am, I'll be transferring you to another position this time, okay? Alright, we will not be putting any pillows on the head, but this time we'll be putting pillows under her feet. Okay. Alright. Now I'll be putting another pillow on her trunk. Okay, now ma'am, I need you to lay down. I'll be needing another pillow for the feet. Okay. Alright, like we can use another pillow under the client's abdomen to assume the Trendelenburg. Let me just pull you up, okay? Can you pull your butt up? Alright, go ahead and pull down. Okay. Alright, so this is the Trendelenburg's position wherein the lower parts of her body is slightly elevated or elevated than the head. So another type of Trendelenburg is the reverse Trendelenburg position wherein the client's upper body or upper extremities are elevated than the feet. So as it was called reverse, we will be just doing the same procedure, but this time we will be putting pillows under her upper body. So first, I'll be putting a pillow under her head. One sec. I'm going to be using the larger pillow. So ma'am, I'm going to be putting this under your pillow. Your head. One more. Okay, can you pull yourself together up? Further. Further. Go up more, please. This just help you up. 1, 2, 3. Yeah. Okay. Now, one pillow under the client's buttocks or trunks. Kindly lift yourself. Okay. Alright, go down. And one more, I think, probably to, under her knees. Okay. Go ahead and sit. Alright. So just to imagine that we are doing a reverse Trendelenburg's position using an adjustable bed. So it's gonna go like this. The upper body is higher than the lower body. So this is reverse Trendelenburg's. And that concludes all of the position or therapeutical position that is included for this demonstration. But also there are two other types which I can't do here because it's not a hospital setting. We have the jackknife position and the kidney position. So these were a couple of positions that is appropriate for different procedures as well. So that's it for today. Thank you so much for watching and have a great day.